Good morning, good afternoon, and good evening, everyone. Thank you for being here with us today. My name is Francesco Del Carpio. I'm the CFAL York Operations Coordinator, and I would like to officially open the second session of our AI for Global Health Challenges and Lessons Learned speaker series with a land acknowledgement. We acknowledge and recognize that many Indigenous nations have longstanding relationships with the territory upon which our campuses are located that precede the establishment of York University. The area is known as Takaranto and has been caretaken by the Anishinaabe Nation, the Haudenosaunee Confederacy, and the Huron-Wendat. It is now home to many First Nation, Inuit, and Métis communities. We acknowledge the current treaty holders, the Mississaugas of the Credit First Nation, and the territory, which is subject to the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. As this is an online event, our participants may be joining from various locations, so I strongly encourage you to learn about the traditional land upon which you are located. With this, I'd like to welcome our moderator, our speaker, and our participants from around the world. Welcome to our webinar. And I'm happy to say that the series has been extremely well received with almost 400 registered participants by today. So without further ado, it's my great pleasure to introduce our moderator, Dr. Blessing Ogbuokiri. Dr. Blessing Ogbuokiri is a postdoctoral fellow and instructor at York University. He has over 15 years of combined professional experience across a broad range of fields in academia, industry, and community-based organizations. He's a dynamic team player who is eager to utilize his diverse talents to advance in research and innovation. Dr. Ogbuokiri is interested in machine learning for health, data science for social good, social media computing, natural language processing, and theoretical computing. His goal is to actively collaborate with researchers in several interdisciplinary groups using AI to help government and local communities to contain and manage the spread of community-based infectious disease outbreaks, such as COVID-19, malaria, and Mpox. Dr. Ogbuokiri, thank you for moderating today. The floor is yours.
Thank you very much, Francesco, and welcome our audience to this, our second AI for PEP lecture series. Before I introduce our speaker today, I'd like to, reiterate our minds to what AI for PEP stands for. It's good for us to know our goal and our specific objectives while we are actually doing what we're doing. So in AI for PEP, our general objective is to strengthen equitable and responsible public health systems that leverage Southern-led responsible AI solutions to improve prevention, preparedness, and response to emerging and re-emerging infectious diseases outbreaks. And some of our specific objectives are to deepen the understanding of how to use responsible AI solutions to improve public health preparedness and response to emerging and re-emerging infectious disease outbreaks. We also, focus on establishing and support a multi-regional network across the global South to address gaps in knowledge, capacity, and solutions. We try to also inform national, regional, and global policies and practices on the use of AI to improve health equity and strengthen public health systems. At this point, I would like to introduce our speaker for today. Our speaker for today is going to be Dr. Woda Gabriel Asefa Woda-Grima. Dr. Woda-Grima is a newer faculty member as an assistant professor at the Department of Mathematics and Statistics at York University as of July 2021. He moved to Canada in September 2021. Before the recruitment to York University, he was a postdoctoral research fellow at the Mathematics Models and Methods in Bioscience and Bioengineering Lab at the University of Pretoria, South Africa. Dr. Woda Gabriel obtained a PhD from the University of Buea in Cameroon in collaboration with the Lehigh University in the United States in August 2018. His dissertation title is Mathematical Modeling and Analysis of Immunopathogenesis of the within human host and mosquito vector cellular level dynamic of malaria parasites. He obtained a master's degree and in one master's degree, one from the African Institute for Mathematical Science, that is AIMS, with a mathematics thesis on existence and uniqueness of viscosity solutions for Hamilton-Jacob PDE and applications to optimal control theory. And a second Master's of Science degree from Addis Ababa University in Ethiopia in functional analysis. I welcome Dr. Woda Gabriel Asefa Woda Grima for his presentation.
Okay,
Dr.
thank
Grima,
you.
over to you.
Thank you very much, Dr. Blessing, for the great introduction. And I would like to share my screen first of all before I begin. And okay, sharing. Okay, can you see my screen?
Yes, can see your screen.
Great. Thank you very much. Thank you everyone for joining us today. We appreciate you for taking time to join us today. And my name is Wolde Gabriel Wolde Gerima, and my colleagues have already introduced me. I am not going to talk about myself. And today, as part of the speaker series on artificial intelligence for global health, I'm going to talk on artificial intelligence for pandemic preparedness and response. My talk will not be on a specific work, but rather it will be kind of survey on the current trends and uses of artificial intelligence towards preparedness, control, and elimination of pandemics and the different measures that are used as a response means in order to tackle an ongoing outbreak or pandemic. So I would like to start with the general overview of my talk, which will begin with trying to summarize a brief literature on what do we mean by pandemic preparedness and response, and what is required as a community, a government, and as individuals, what is expected and required in order to prepare ourselves for emerging or re-emerging infectious diseases that may become worldwide pandemic. And once I introduce the general brief introduction on the literature for pandemic preparedness and response, I'll then move to introduce about what is artificial intelligence and what the different kinds of artificial intelligence with respect to the use towards global pandemic and infectious disease control. And then I will try to see some of the current research works on the use of artificial intelligence, particularly the use of different machine learning techniques, which will be focused on public health and global health. I will also consider some specific examples by taking which type of machine learning approach has been employed in order to study or solve a health problem. For example, the current ongoing COVID-19 pandemic. I will also mention some examples as considering ACADIC, which is artificial intelligence for Artificial Intelligence and Data Innovation Consortium, which is directed by Professor Jude Kong here, and where the Dr. Blessing is also a postdoctoral researcher. I am also a member of this academic, and our Professor Ali Asgar is also a member of the academic. And then I will try to see also what is ethics on the use of artificial intelligence. So to begin with, I will start what do we mean by pandemic preparedness and response? What is expected from community, from governments, and from individuals? And for that, as has been observed for the case of COVID-19, recently, many environmental, climate, and other socio-economic factors are contributing to the emergence or re-emergence of new infectious diseases. And this may be likely becoming because of the spillover from zoonotic traits. For that, for example, what happened during the COVID-19 was once the COVID-19 has started transmitting in a community, I think we were not ready, the governments were not ready, much effort was not done, and much investment and funding was not there in order to at least reduce the transmission or the other impacts, including the thousands or hundreds of thousands of deaths, and after COVID influences such as long COVID, which is related with other indirect human disease, human infections, or related, for example, with kidney, heart, and other impacts. Of course, we also have the major impact of the impact of COVID-19 on the economy of a community and the country. That's why pandemic preparedness is very important. Planning ahead is very important, especially with regard to the zoonotic spillover threats. So in that case, the main question would be, will there be a next pandemic? That will not be a question. Of course, there will be. That is what we have learned even from COVID-19 and other recently, for example, monkeypox, and again, other types of re-emerging infectious diseases. And the main question should be, when is going to happen? How much are we going to get prepared? And what prevention and control strategy should be prepared? And what planning should be done ahead? This is one of some of the concepts or key questions that are related with pandemic preparedness and response. Of course, in that case, one of the definitions which is provided by the Public Health of Canada is planning for a prolonged and widespread health emergency of unpredictable impacts is very challengeable, but it is very essential. That is why it requires the whole society, the whole community, the government, the individuals, and then non-NGO funders and researchers, mathematical models, or artificial intelligence experts, engineers, and all this is a combined effort that will help us to plan for emerging pandemics. Having said this, then the next one is that what is important to plan? One way or the other, I already mentioned, but I just want to mention that because once an infectious disease starts spreading, then it will infect large proportions of the human population, what comes directly to our mind is because people are sick, infected, or some of them may die. But there is also a consequence, indirect consequence, including the prolonged other diseases which are caused by the ongoing infection. Secondly is the impact on the economy. There will be a lot of absenteeism from work. There is a lot of unemployment becoming and other consequences. That's why it is very important for pandemic preparedness planning and making ready that there will be an adequate response. So as a definition, for example, according to the European Society for Control, Disease and Prevention, a pandemic plan is simply a living document which is viewed at intervals and revised if there is a change in the global guidance or evidence-based. And again, lessons learned from a pandemic and an exercise or other relevant outbreaks has to be considered during pandemic planning, or changes to national and international legislation related to communicable disease prevention and control should be also taken into consideration when we talk about pandemic planning. Okay, so that's why pandemic preparedness is most effective. It is if it is built on general principles that guide preparedness planning for any threat towards community and the whole population. For example, according to the European Center for Disease Control and Prevention, the key elements of pandemic planning can be categorized as follows, as we can see here, which I have obtained directly from the website of the European Center for Disease Control and Prevention. It says that if we want to have an effective pandemic preparedness, then we have to have, of course, strategic planning, then we have to have an operational planning. Then once we have the operational planning, then we have to exercise them, we have to view them, we have to see what should be added and what should be improved. Once we have those things, then we have to implement in order to plan and prepare for upcoming pandemics, or if there is an ongoing pandemics, to reduce the prevalence, incidence, the mortality, and other indirect consequences of that pandemic. And then once we have the implementation, then we have to evaluate in order to improve that planning. This is something that has to be considered. Of course, such new systems that will be implemented during a pandemic will be an inter-pandemic period, has to be evaluated during inter-pandemic, and they have to be tested, because those planned actions or planned activities may work or may not work once the pandemic starts spreading among the population. That's why it is very important for testing and evaluation and improving. Of course, as we have learned from COVID-19, not all countries will be in a position to contribute to global risk assessment or conduct evaluations such as pandemic, vaccine effectiveness, or other control strategies. That's one of the problems that has been observed during the COVID-19. This is because of the, of course, the economy imbalance, and then unequal distribution of economy and unequal distribution of vaccination has been observed, and other unequal distribution of even testing kits and other strategies. And this is something very important that governments in developing countries has to have a very actionable plan, and they have to fund in order to have a pandemic preparedness plan. Okay. So I already have mentioned this one. One is what I have tried to mention earlier, is because the responses toward this pandemic must be evidence-based and must be tested and must be re-evaluated. Okay, so I took this is something, a summary of, for example, one of the summary of the pandemic preparedness, which is prepared by the Global Fund, where they are trying to have some pandemic preparedness and response to different diseases, including HIV, malaria, tuberculosis, and other diseases. And they try to mention, what do you mean by preparedness? How do we have to prevent this, and how do we have to detect those diseases? Of course, detect in this case includes diagnosis and screening, and then how do we have to respond? What type of control measures should be applied in order to reduce the transmission and control the disease? And these are some of the summaries. And as you can see here, what we have is the first one is, when we have to prepare, we have to strengthen our logistics and supply chains. We have to train and expand the health workplace, and including community health workers. Some of you may be wondering that the topic is AI for pandemic preparedness and response. And so far, I'm talking about what is pandemic preparedness and what is response, what response are available, and what's thing. I'm coming back to artificial intelligence. It is very important to understand, first of all, what do we mean by pandemic preparedness, and what type of responses how we have to apply. Having this one into a plan, then we can then collaborate with researchers, modelers, artificial intelligence, computer science, or others, or engineers, in order to make into practice those plans. Okay, that's why I tried to mention somehow what are the preparedness. And the next one is, for example, when you talk about prevention, or what do we mean by prevention? How do we prevent those pandemics? For example, the first one is you have to fight against, for example, transmission, against, for example, if it is diseases such as, for example, malaria or other treatable diseases that have treatment. You can also talk about how we can prevent, for example, anti-malarial resistance or other anti-drug resistance. Or we can talk, for example, what type of investment can be conducted in order to accelerate the uptake and innovation and new tools that can help us to prevent. When we say prevention, it includes both pharmaceutical and non-pharmaceutical interventions. And then you have to connect health systems in order to strengthen that helps to other zoonotic disease prevention and detection, which may create also a collaboration with such as what we call is for disease watchers, including the surveillance and others. And this will also help us to reduce stigma and other discrimination, to increase prevention, testing, and treatment. For example, some of the infectious diseases have their own stigmatization on the individual, and people may scare or may not want to go to testing centers, or may not want to expose or declare their symptoms. And this one has to also be taken into consideration when we talk about prevention and preparedness. The next one is detection, which includes testing, screening, and all these things. And this includes, for example, scaling up testing, and then expanding testing centers, and of course, having equitable testing kits and testing centers all over the world will be very important. If developing countries are only considering testing capacity to strengthen their testing capacity, that will not solve the problem, because diseases can migrate when one population can migrate. Okay, so response should be also evidence-based. It should deploy rapid rapid strategies in order to prevent such pandemics and outbreaks. Having said this is a few brief review about what is pandemic preparedness and response, then I want to move. The next one is what is artificial intelligence. Before I go to the main topic of today is the use of artificial intelligence on pandemic preparedness and response. But I want to briefly introduce again what is artificial intelligence, which will start here. Of course, what are artificial intelligence? What is artificial intelligence? We hear artificial intelligence here and there, everywhere in the news, in the books, and everywhere. Of course, we, one way or the other way, knowingly or unknowingly, we are using artificial intelligence in our day-to-day activity, including in our mobile phones, including in our laptops, including if we are using some, for example, mathematics or statistics to predict something or simulate something. One way or the other, you are using some machine learning techniques. And in generally, of course, artificial intelligence is also used on other advanced innovation and technology, including robotics, including smartphones, or including the latest modern cars or airplanes, and etc. But there is no a definite definition of what is artificial intelligence. I'll try to mention a few phrases and sentences that I have obtained while reading some of the literatures on artificial intelligence. And as such, I can start by saying that artificial intelligence is simply a machine that can mimic human intelligence. It's a form of algorithm or machine that can mimic humans' intelligence. Or artificial intelligence is simply the science of making machines to do things that would require intelligence. Such intelligence can be done by human beings, or can also be even, those machines can also even perform those activities better than human. I will come back to those lists later on. And what is the use of artificial intelligence is, of course, one is to automate, such as, for example, we mentioned about the latest cars or other machines, or it can help us to predict, for example, weather prediction and forecasting. I wonder, for example, let me explain. So 3 days ago, okay, not only, on last Friday, then there was a news in the TV. And again, even inside the University of York University, we have been told that we have to leave as early as possible by 5:30 p.m. because there is a snowstorm coming. Everyone has to leave and go home and stay at home. Okay. When they were sending us this emergency notice, you can see the outside, you can see the sky. It seems that everything is fine. But as I said, around 6 p.m., storm came, snow came, and you may wonder that how do those researchers or scientists know? How do they predict it? It's because of the application of artificial intelligence and machine learning. Of course, those machine learning and artificial intelligence are algorithms, and those algorithms are designed or written on mathematical and statistical concepts. That's why we always say that mathematics and statistics, generally, I will use that one in mathematical science or mathematical tools are the basis of machine learning and artificial intelligence. I may come back later on to some of the details in this one. Another way is also you can use artificial intelligence to optimize tasks. For example, particularly, of course, there are many other applications, but with regard to today's topic, I will mention, for example, artificial intelligence can be used by doctors or other public health units in order to optimize testing, in order to optimize the record of patients, in order to optimize other treatment and in the innovation of vaccines or new drugs for treatment, etc. Or artificial intelligence can be used, for example, facial recognition, prediction, decision-making, and transformation. I just mentioned only a few of the several applications of artificial intelligence. And of course, artificial intelligence can be divided into 3 categories. The one is what we call is weak artificial intelligence. Then we have the medium artificial intelligence or the strong artificial intelligence. When we say weak and strong or medium is depending on the use of the artificial intelligence. If you consider, for example, the chatbots, including the Chat GPT or Chat Sonic, those are strong artificial intelligence. They can do several sophisticated work. But in this case, in terms of algorithm or in terms of methods, artificial intelligence can be classified according to the following classification, because artificial intelligence can behave as an umbrella term that includes machine learning, natural language processing, deep learning, image processing, robotics, and other several fields. Usually, we confuse with the use of machine learning artificial intelligence as a word. I sometimes use machine learning and artificial intelligence as the same or similar. Of course, no. Machine learning is one subset of artificial intelligence. Okay, so in terms of academics, of course, artificial intelligence can be used in engineering, can be also used in academics by mathematicians or physicians or engineers to just do to conduct some research and make some predictions for some physical phenomena, including the transmission of the infectious diseases, or including the predicting weather, including predicting earthquakes, or even trying to understand or optimize production of agricultural resources or production of fish harvesting and etc. But again, in terms of pandemics, artificial intelligence or machine learning approaches can be used as follows. For example, it can be used for diagnosis, it can be used for treatment, prevention, and again, it can be used in facilitating vaccine formulation. It can be used even for surveillance to watch emerging or emerging infectious diseases. Especially, it can be used in early warning detection of re-emerging or re-emerging or emerging infectious diseases, etc. And of course, we can also use artificial intelligence for health equity by, as I tried to mention, that by providing equity in terms of vaccine distribution, test kits, and other factors, including economic aspects. Of course, we can also use artificial intelligence for transmission detection in the sense of measuring the prevalence, incidence, and other impacts of the ongoing epidemics. Having said this, then the next one is that the question would be, recently, the use of artificial intelligence, particularly machine learning, in research and academics has increased greatly. Of course, the history of artificial intelligence is not new. Artificial intelligence was there for several years, but in the past decade, starting from 1980s or 1990s, the use of machine learning in academics and research has shown great interest, and there is a lot of work on this one. And the question would be, why is the use of artificial intelligence growing rapidly recently? Of course, there are a lot of answers for this one, and one of the answers is because of the current research uses big data in order to analyze, predict, and make decisions. For example, big data is obtained from social media, including Twitter, Google, YouTube, and other social medias. And then, in order to make sense of this big data, you need to use some mathematical tools. And one of the most important mathematical tools is using machine learning or artificial intelligence. So this is one of the reasons behind the recent growing interest towards artificial intelligence, particularly machine learning in academics and research. Of course, the same goes to other innovation, including in car factories, manufacturing generally, and etc. The next reason is also, of course, the computational capacity. There is, because of the involving big data, it requires a big computation capacity and effectiveness or accuracy. But because of the already existing machine learning algorithms, it can help us to do high computational capacity in a short period of time. The next one is, again, of course, there is a greater demand for data-driven decisions, including public health decisions and for policymakers towards controlling an infectious disease or towards preparing for emerging infectious diseases. Having said this, I would like to show you quickly a summary of the difference, or of course, the classification of artificial intelligence, which behaves as an umbrella for machine learning, deep learning, and other things. So as I mentioned, that here is a very simple summary. The first one starts with the broad classification. We have artificial intelligence. Then under artificial intelligence, I tried to mention that there are a lot of subgroups, including machine learning, language processing, robotics, and etc. But in this case, I wanted to mention those which are mostly used in academics research, particularly. For example, we have the artificial intelligence. And then, as I tried to mention, is that artificial intelligence is just a machine or a technique that mimics the human intelligence, that can do the work, that has been performed by human intelligence or beyond that. Of course, it enables computers to mimic human intelligence behavior and to make machines perform cognitive functions. And under the artificial intelligence, we have machine learning, which is a subset of the artificial intelligence. And this is simple algorithms that can use data and learn from the data, and that they can apply what they have learned in order to make predictions and inform decision makings. Of course, in this case, what we have, the next one is deep learning, which is also a subset of the machine learning. And under the deep learning, it is actually simply a subfield of machine learning. And in this case, when we say deep learning, the deep refers to what is deep learning, because it uses the neural networks, which are built on the concept of human neurons. We have human mind. The human mind is, of course, created on the neurons. Because of the understanding of how neurons perform in human mind, then neural networks were developed. And those neural networks performs or behaves like the neurons of human mind. And in this case, the deep refers to the number of hidden layers or neurons that are used in the neural network algorithm. Of course, it can be said a lot about deep learning. Probably I may come back later on if I have some slides, but this is by itself more than a book, several books, of course. I'm not going to go with the details of how each of those works and what type of algorithm is applied to what type of data and etc. I'm not going to go with those details. I'm going to just quickly go with a brief overview of what are all those techniques. And of course, I will mention as a summary that machine learning and deep learning are the two main branches of artificial intelligence out of many branches, and they are the two main branches that are used in academic research, particularly, for example, on academic research towards pandemic preparedness and response. And when you say machine learning, that are simple algorithms that can use data, learn from it, experience, and make predictions and give us decision-making suggestions. Okay. So of course, under deep learning, we have also some algorithms that can be used, such as, for example, we have the convolutional neural network, we have recurrent neural network, then there is DPN, which is called deep brief network, then we have the LCM, which is one of the famous, and then we have another ones that we call transformers, etc. Of course, I am mentioning only a few of them. Don't consider that this is only algorithms under deep learning and etc. Okay, so then again, the next question is that I think there is a question in the chat. Should I have to respond now or okay? Okay, good. No, the question is not for me. Okay, excellent. So the next question is that now, what is the connection between data science and machine learning, or data science in general, artificial intelligence? Because those algorithms for machine learning works on when we feed them data. And this one comes on with data science. And that is, data science is simply a broad field that utilizes artificial intelligence or machine learning algorithms and some other mathematical tools such as statistics, probability, linear algebra, calculus, differential equations, in order to uncover insights and patterns from the data. That's what we call data science. Of course, a data scientist is simply an individual who works on mathematical and statistical tools to analyze, pre-process, predict, and forecast using some machine learning algorithms and other mathematical tools. And of course, there are other keywords related with data science, what we call the data analytics, big data, data visualization, and all this, etc. And these ones are interrelated with the study of artificial intelligence, particularly with machine learning. And I can quickly summarize what is in the next slide is what is machine learning. And this is something that I have mentioned one way or the other. And what I said was machine learning is simply computer programs or algorithms that can access data and use it to learn from it themselves and experience it, and then they can give us some predictions. Of course, those algorithms can improve automatically through experience depending on the type of machine learning algorithm or method is used to tackle that problem. Okay, so the algorithms can generate a set of course, a set of rules based on those identified data patterns. It depends, of course, that's why I was trying to mention in the previous slide about the connection between data and artificial intelligence, because the algorithms of machine learning learn from the data of the input. And it continues other explanations of the machine learning. I tried to mention all those in the previous slide. Then let me continue about a brief history of machine learning. As I tried to mention earlier, what I said was machine learning or artificial intelligence in general was there. It is not new. Especially many artificial intelligence algorithms or methods has been developed since the 1950s, 60s, and 70s, even some others before that. But what is new is that the use of machine learning in current research is new. Of course, in recently, especially starting from 1986 onwards, there was a huge interest towards the use of machine learning in academic research and in manufacturing. That is what is new, but we can see some of the history, for example, as follows. But before that, let me go, for example, with the origin of the machine learning, which is very important. Of course, there is a lot of debate and there are a lot of different researches that tell us about the origin of machine learning, but I would like to mention one of them here, which is often credited to a psychologist from Cornell University in USA, named Frank Robert Bellet, who was, of course, a professor and researcher at the Cornell University. And he used the concept of machine learning on his work on human nervous system. And he developed a machine capable of recognizing letters, alphabetical letters, which was done in 1960. That was the origin. Even though the origin of machine learning starts from this year, but it was in a silent mode until the 1980s or 1990s. And that's why people usually say that a great interest and attention has been given to machine learning starting from the past decades, that's approximately 10 to 15 years. So we can see that some of the algorithms in machine learning are, for example, of course, we have linear and logistic regression, and there are a lot of them. Suppose, for example, we have a support vector machine, and we have the KNN, we have artificial neural networks, we have other decision tree, random forest, and etc. If we try to see some of the origins of those ones, it starts from 1960s and continues to other years. But as I tried to mention, it is from 1986 onwards where there was huge interest towards the use of machine learning. Okay, so I would like to try to answer the following question briefly: is how does machine learning work? Okay, of course, machine learning is an algorithm, but you have to feed this algorithm data in order to use the past data to learn from the data, train, and make some predictions about the future. And that's why we call machine learning works by utilizing many different types of algorithms that can make intelligent predictions based on data. Those data can be structured data or unstructured data. And in this case, machine learning assesses vast amount of data, including structured and unstructured data, and where this machine learning learns from the data in order to predict the future. It learns from the data by using several algorithms and techniques. And of course, in this case, what do we mean by structured data and unstructured data? Of course, that's, as the English name indicates, structured data is simply highly specific and it is stored in a predefined format, whereas unstructured data is simply a collection of many varied types of data that are stored in their native formats. That's simply straightforward. Okay, next question is, for example, I tried to mention the keyword called data analytics. And I also mentioned that machine learning algorithms are dependent on data, of course, on data science. And the other keyword is about data analytics. What do you mean by data analytics? And what is the relation between data analytics and machine learning? So the first one is, I will try to mention one of the definitions given by the Oxford is what is data analytics is simply the science of analyzing raw data for insights and trends, that is to make predictions, and from those predictions to make some decision making, and of course to recommend for policy makers. And again, from this, you can make some conclusions about that information. So analytics can include different types of approaches, including this descriptive. Then we have diagnostic, predictive, and prescriptive. Of course, we have the other one is cognitive analytics. And sometimes we may get confused ourselves that when we talk about those analytics, we may consider it's related only with statisticians. No, it is data analytics includes statisticians, mathematicians, of course, computer science. That's what we call. And why do we need the data analytics? Is because once we have those techniques and implement them, then it can be used for the discovery, interpretation, and communication of meaningful patterns in the data, which will be used for effective decision making. Of course, the analytics also relies on the simultaneous applications of statistics, computer programming, operational research, mathematical tools. Okay, so for example, when I try to mention about the different types of analytics, I mentioned about descriptive, diagnostic, predictive, prescriptive, and cognitive analytics. And this is the area that I obtained from literature, which I have cited here. And what do we mean by descriptive analytics is, for example, the descriptive analytics mainly tells us about the past, and it is reactive. And it tries to answer questions such as, for example, what happened? For example, if you talk about the pandemics, such as there are some pandemics that have been eliminated from some countries. And if we try to answer, for example, to ask a question such as what happened during the, for example, the disease that has been eliminated in 1960 or 1760, there was a, okay. There are other questions. I just mentioned about only infectious diseases, but there are a lot of questions that can be answered using this one. But it tells us about the past and uses some algorithms such as, for example, performance indicators in statistics or matrices. Or you can use also the OLAP, which is online analytic processing, which can be defined as the fast analysis of multidimensional data. Of course, the online analytic processing supports activities such as data summarization or time series analysis, and including to tell us what happens if this analysis has been conducted during that time and other related questions. The next type of analytics is what we call predictive and prescriptive analytics, which are important, especially for predicting different real-life problems, including infectious disease emergence or weather prediction and other predictions. And they are important to analytic for the future and to make predictions, of course, as its name indicates. And then it also helps us to answer questions related with what will happen, what is next. So these are questions related, for example, in the current case of COVID-19, there are a lot of questions that can be answered. What will happen with the current pandemics of COVID-19 if it continues spreading like this one? What other consequences related what we call is long COVID or after COVID? Those are questions that can be answered. Of course, for example, when there was first dose, second dose, and third dose, and fourth dose vaccinations, there were questions that can be asked, like, for example, when we were doing, vaccinating within the first dose, mathematicians were trying to ask a question or trying to answer a question which was asked by public health units, such as, what will happen if we give the second dose within 2 weeks or within a month? What proportion of the population will be immunized? And there are different questions that can be answered by such types of analytics. Okay, so the algorithms such used in predictive and prescriptive analytics are, for example, it can be used by predictive modeling, such as many of the infectious disease modeling approaches that we use, or it can be by data mining or other machine learning algorithms. Okay, then having said this all about what is machine learning, what is artificial intelligence, what is machine learning, let's try to quickly see the different algorithms that I have been mentioning earlier, different algorithms that can be used in machine learning research and application. For example, there is a lot of classification, but the main classification is according to the level, according to the type of data used. And in that case, it's very important in order to, first of all, define what do we mean by level in machine learning. A level is simply a dependent variable that is simply the specific value of the outcome. So depending on the level of the data, we can classify machine learning into supervised learning, unsupervised learning, and reinforcement learning. Of course, some researchers also include the fourth one, they call it semi-supervised learning. And I will try to quickly show you what do we mean supervised learning and when can be used, and the same thing for the other types of machine learning techniques. Of course, most of those areas and concepts I'm trying to show you here or I'm trying to mention are not my own work. These are obtained from different references and textbooks. Of course, I have tried to properly cite most of the areas that I have taken from references. For the first one is, what is supervised learning? As its name tells you that it is a supervising learning, means there is a supervision. But the definition using the labeling of data is simply supervised learning uses labeled data sets. And in that case, the data is already labeled, which means that we know the target variable. For example, if we have input, independent and dependent variables, and if we are using supervised learning, that means you already know what is the dependent variable and what is outcome. For example, if you want to model, for example, the transmission of COVID-19, and you want to study, for example, the vaccine coverage, then in that case, you have the data and it's leveled according, the data is leveled, and you have this is the proportion of people who are vaccinated, proportion of people who are not vaccinated, proportion of people who have second dose and something. So in that case, you have leveling. Of course, I'm just mentioning one example, but this is very good. It can be applied in many problems. Okay, so in that case, we have input data, of course, output one data. Then we use the techniques under supervised learning as what we call is classification and regression, such as, for example, linear regression, logistic regression, and other types of techniques that I will mention earlier. And then we create a model, or with the machine learning we train by itself in order to make predictions. And some examples of the methods or techniques for supervised learning are, for example, what we call is classification and regression. And for the case of classification, what do we do is that we classify the data according to some predefined categories, such as, for example, the classification starts with a set of data and it predicts if the output belongs to certain category or class. For example, if you consider medical imaging, when we take the medical imaging, for example, MRI or CT scan, then how do the physicians or the doctors know that what is happening? Once they saw the image, then they need to mention that you have this problem or there is something happening with your head or heart or kidney or something. How do they know that? Because there is a classification done there. So, okay. Dr. Blessing, I see hand raised. Should I have to respond the questions now, or I'm fine with anything, or I have to wait until the end?
Just finish your presentation first. We'll take the questions after the presentation.
Okay. So I'll continue. Okay. So this is what I call, for example, medical imaging. And of course, another classification is, for example, if you have data, then you can classify, you want to study, for example, about gender, or you want to study about timing, then you can also classify the data according to those things. And again, there are other applications that can be modeled and studied using classification and regression. And there are some methods that I have listed here as, examples of classification, such as classification trees, support vectors, and again, we have the random forest. Those are some of the main methods that are used and applied in machine learning. And we have, of course, the artificial neural network. Then we have the other one is simple methods, logistic regression. Of course, in this case, sometimes it's confusing that the name says logistic regression. It seems that logistic regression should be a method used in regression, but it is also used in classification. Okay. Okay, so I already mentioned this one. And again, what is the difference between classification and regression? A simple word is that I mentioned classification simply uses a set of data and predicts the outcome by certain category or class. And but in the case of regression, what does regression does is that they predict a value for that variable, because in that case we will try to define what is the input and output, of course, or I would rather say dependent variable and independent variable, and then using the regression analysis, then we can predict the value for the variable that is for the level data. Of course, still we have different methods that can be used for regression, including the famous one is the linear regression. Then we have the generalized linear regression, logistic regression, which can be used for both classification and regression. And we have other types such as the decision tree and artificial neural networks also can be used for both classification and regression. And there are, of course, there are a lot of methods that I'm mentioning only a few of them here. And I have if you need further details about those methods, I try to include the reference where I use it here. Okay, the next one, this was all about supervised learning, and the next one is unsupervised learning. And in the case of unsupervised learning, we have algorithms that can be employed to analyze and use unlabeled data in order to detect structures and patterns. In this case, we have the objective is to detect patterns or structures from the given data. In that case, we have input data, then we apply the unsupervised learning in order to make clustering association in order to observe some structures or patterns from this data. And there are, of course, techniques or methods used in unsupervised learning, including the k-means clustering. Then we have the hierarchical clustering, and of course, and of course, we have the other one is what we call anomaly detection. Those are algorithms that can help us for supervised learning towards clustering and association, which will at the end help us for pattern discovery and structure observations. Of course, as its name indicates, we have the semi-supervised learning, which uses both labeled and unlabeled data. And in this case, this is something which is not mainly used, but still it is applicable. And the main objective is to simply understand how those labeled and unlabeled can tell us about changing in the behavior of the learning for the machine learning. Okay. I know that there are a lot of questions related to this one. I will quickly jump because I think time is going. I have to go quickly to the main topic of talk, which is simply a summary of the different techniques of or methods of machine learning. And I will continue. The next one is, which is one of the important one, is the reinforced learning. Of course, in the case of reinforcing learning, we use this method in order to train the machine in order to complete a specific task in a certain environment, such as, for example, it allows machines or softwares in order to automatically evaluate optimal behavior, including, for example, we use neural networks in order to optimize or predict what will happen with some phenomenon we have input data. Okay, this is summary. I'm not going to say with this one. This is something that I already mentioned. Okay, I tried to revise this one in the previous slides. And the next one is, for example, some of the main algorithms or methods that are used in the three main classifications of machine learning. And in the case of, for example, supervised learning, we have classification and regression. However, in the case of supervised learning, we have clustering and, of course, association. And again, in the case of reinforcing, we have such as what we call this Q-learning. And the methods under classification includes naive Bayes, support vector machine. Then we have the k-nearest neighborhood. We have decision tree, random forest, neural networks. And again, of course, we have the logistic regression. And again, under regression, we have other methods that are, as you can see in the screen. And I will continue with other types of methods that can be used for unsupervised learning, which are, for example, of course, the neural network is everywhere, but we have, for example, the hidden Markov model. And again, we have the Gaussian mixed errors. But in the case of reinforced learning, mainly these ones are, as I tried to mention, is that to give our outputs which after training, such as, for example, used in proximal policy optimization. It can be also used in trust recognition policy optimization. Okay, so this is a summary of course, we have some summary of what I have tried to mention earlier, and including we have is the different types of machine learning and the different types of algorithms used for each of those types of machine learning. And what is the advantage and application of each of these categories is as follows. If I start, for example, with supervised machine learning, it can be used, for example, in population growth prediction. It can be used in market forecasting. It can be used in estimating life expectancy of humans or animals or other bacteria or viruses. It can be also used in weather forecasting. And again, more or less, it can also be used in predicting transmission of infectious diseases and, of course, towards pandemic preparedness. And in this case, for example, particular as part of the these are all that I have mentioned as part of regression, which is supervised learning. Then if we continue, for example, classification, which is a supervised learning, then classification can be used, for example, in identifying fraud detection. It can be used in diagnostic, in medical diagnostic and image processing. It can also be used in other customer retention activities. If I continue, for example, for unsupervised learning, we have clustering and, of course, dimensionality reduction. Under clustering, we have, for example, we can use those algorithms in targeted marketing, such as, for example, the ads that we see in YouTube or our other social media. It can be also used for customer segmentation. For example, these ones can be used in, for example, in hotels, big hotels, or other activities, restaurants, etc. Even can be used, for example, in hospitals and others. Of course, we have another one is what we call the dimensional reduction. What do you mean by dimensional reduction is, for example, when we have big data visualization, we can use dimensional reduction in order to make some reduction in the dimension. And again, of course, it can be used in structure discovery, which is part of course, unsupervised learning. And again, it can be helpful in pattern discovery. And the other one is what we call the other branch of machine learning is reinforcement learning, which can be also used, for example, in gaming. It can be used, for example, in learning tasks, robot navigation. It can be used also real-time decisions and detections, for example, Google Maps and etc. Okay, this is generally what is more or less machine learning and etc. And now the next one is there are some, of course, keywords that are used in machine learning and artificial intelligence. I'm not going to allow me to jump this one. I will leave it there. For example, what do you mean by accuracy? What do you mean by data mining? Or what do you mean by, for example, features levels and etc. Those are some keywords that we use in machine learning and artificial intelligence applied to public health and, of course, infectious disease prevention and treatment algorithms from machine learning. Okay, the next one is now. So far, I have tried to briefly introduce what do you mean by pandemic preparedness? What types of prevention responses and other treatment and vaccinations should be applied for pandemic pre-planning and etc. Then I continued with the general introduction of what is artificial intelligence and the different categories of machine learning and how they work with their corresponding applications. And mainly here, what I want to talk is about how is machine learning used in pandemic preparedness and response, which is the most important part of this talk. And of course, the first thing is that I already mentioned that artificial intelligence can be applied in several fields. And particularly one of them is in public health, clinical health, and of course, on global health. And as a particular example, we can mention that artificial intelligence can play significant roles in pandemic preparedness and response. It can help us, for example, in prevention. Prevention in the sense is that it can help us prevent from infectious diseases occurring. Once they are transmitting among humans, it can also help us to reduce the level of transmission. It can also help us for identification of emerging infectious diseases, including, for example, for zoonotic traits. I will show you one paper later on, which they have used machine learning for identification of early warning zoonotic traits. Of course, it can help us also for risk management and again in decision-making processes. Again, of course, when we talk about helping, machine learning can also help us to detect outbreaks. What do you mean by outbreaks? We can also use machine learning in predicting the spread of diseases, prevalence, incidence, and again, of course, what type of control measures has to be applied in order to control the transmission, or in order to control hospitalization, in order to reduce hospitalization, in other words, or in order to reduce the indirect impacts of the ongoing pandemics, economically, socio-economic factors, stigmatization, of course, absenteeism, and other factors. And the other application of machine learning is also, it can help us to optimize supply chains, including testing kits, treatments, of course, supplying drug to remote areas or to developing countries. It can also help us to optimize management, and can help us to aid diagnosis during diagnosis, screening, and treatment. Of course, it can also facilitate contact tracing. How does that work? I'm going to show you, for example, here. For example, when we say that artificial intelligence can help us in early detection and tracking, what do you mean is that by using artificial intelligence, we can early detect and track outbreaks by analyzing large amounts of data obtained from social media, news, health reports, of course, other geospatial geographic locations, including by data obtained from GPS and satellites. Another one is, in that case, it can, once we have early detection and tracking, then we can now recommend the public health units, or of course the decision makers who are working in the government, especially in health ministers, in order to make pre-existing control strategies in order to reduce the transmission or not to occur transmission. The other one is, for example, we say that we can use artificial intelligence algorithms for predictive modeling in order to make predictions. For example, to predictive models can understand the spread of pandemics, can also predict hotspots for re-emergence or emergence of infectious diseases, including spillovers or other zoonotic threats. Predictive modeling can also help to inform response strategies. What type of measures should we conduct in order, or apply in order to reduce the transmission, or in order to control the transmission and other factors related to the disease. Another one is, for example, artificial intelligence can also help us in supply chain, which I already mentioned. For example, it can help us to optimize essential supplies, including personal protective equipment, medical supplies, testing kits, or other supplies that are useful in either reducing or controlling transmission of pandemic, or in order to track or detect an early warning. So there are a lot of them. Of course, artificial intelligence can also help us in diagnosis. Once an outbreak is occurring or pandemic is occurring, we can use also optimal artificial intelligence algorithms in order to optimize, or in order to make diagnosis and screening. Of course, in order to make treatment. What do we mean by it in this case is that it can provide us personalized treatment recommendations. What type of treatment should we recommend, the physician should recommend to the patient? And also it can help us in drug discovery and development. Of course, there are a lot of other applications which I am not going to mention here. For example, the other one is contact tracing, which was very important in the case of COVID-19. The same thing for the case of other diseases, such as monkeypox and of course, Ebola. Okay, so in a very simple way, another one is, for example, artificial intelligence can also improve the efficacy and accuracy of healthcare, providing better patient outcomes and reduce costs. For example, in this case, it has been mentioned that diagnosis is one way. The other one is, for example, personalized medicine recommendation. And of course, it can help us to, a doctor can use artificial intelligence algorithms or applications in order to detect the medical history and recommend treatment or other recommendations. Okay, so this one starts one way or the other way that I tried to mention. And of course, as a summary is, artificial intelligence or machine learning models could help in public health officials in order to get before the occurrence of pandemic or outbreak. And of course, indirectly, we can also use artificial intelligence algorithms in order to develop or innovate digital tools that can help people in different areas in developing countries to get help from doctors across the world. Of course, there are special, for example, robotics, for example, used in some countries in Africa, especially in Kenya, Rwanda, and other several countries in Africa, Asia, and elsewhere, where you can use the robotics in order to distribute treatments to villages or to distribute other protective means, including for malaria and other diseases, to remote areas where transportation is not easy. Of course, the concluding statement is that artificial intelligence is important in public health, including public preparedness and response, by using some models in order to inform decision control, screening, treatment, and again, of course, prevention interventions. In summary, we can say that artificial intelligence is important in clinical medicine, public health, and global health. And there are a lot of work that has been employed in order to solve many problems faced in clinical medicine, public health, and global health that are applied using artificial intelligence and other algorithms. I will show you a few of these ones that I took them. For example, the first one is in the case of COVID-19, the use of COVID-19, the use of artificial intelligence in the case of COVID-19 pandemics. And there are a lot of work. I just mentioned a few of them here. And some of the work has been towards prevention recommendation of COVID-19, optimal vaccine uptake, and again, other terminologies related with COVID-19 has been discussed using machine learning techniques. Of course, when I say machine learning or artificial intelligence techniques, other parts of machine learning has been applied also for other diseases, including malaria and other diseases throughout the world. And there are a lot of research. I just mentioned only to show you here. For example, the last one says that they use deep learning in order to model COVID-19 infections, which they help them to forecast the transmission dynamics and other prevalence in India. And of course, this has been applied also in other countries. The other one that they use is not a machine learning, but rather another branch of artificial intelligence called natural language processing, where they use it to identify COVID-19 outbreaks from contact tracing. And this was done by interview forms for public health departments. Of course, I just mentioned only a few of them. There are a lot of other works, but I mainly want to talk about the ACADEC, which is Africa-Canada Artificial Intelligence and Data Innovation Consortium, which is directed by Professor Jude Kong, who is one of the organizers for this speaker series. Of course, I'm also a member of this ACADEC. And of course, we have Dr. Blessing, who is also the organizer of this speaker series, who is also postdoctoral researcher on this one. So what is the ACADEC doing for the past 2 years? During the pandemic of COVID-19, ACADEC has been an active participant towards the contribution in predicting the COVID-19, and again, of course, contributing to other recommendations related with vaccination coverage and other indirect impacts of COVID-19 related with other diseases in Africa and Canada. And this ACADEC has tried to use recent developments of the application of machine learning algorithms in order to contribute towards improving COVID-19 screening, diagnostic, and make predictions, and of course to make a timely response in order to make some recommendations to the decision makers, of course, and other units. Of course, I can quickly show you some of the works that has been done by ACADEC, and I would like to just mention that simply in general, ACADEC has been strengthening equitable and responsible clinical public health systems that leverage southern-led responsible artificial intelligence solutions and big data analytics in order to improve prevention, preparedness, and response. How, of course, other responses toward this re-emerging and emerging infectious disease outbreaks. How was the academic doing those activities? One way is, for example, by having dashboards that can tell us the timely current cases of COVID-19 and days of COVID-19 country-wise and region-wise. And again, of course, the academic has been using also existing and improved mathematical models to fit them using machine learning and artificial intelligence models in order to make some predictions, especially using data from Twitter, social media, and etc. I will show some of those works. And of course, as a summary is that this is how the academic has been using and supporting data-informed decision-making in Africa, where the academic has used some artificial intelligence algorithms or approaches in order to make some augmented epidemiological models, where this augmented epidemiological models has been fitted to artificial intelligence algorithms to make predictions, where those predictions were able to predict or project COVID-19 cases and deaths, hospitalization, and other factors related to COVID-19 pandemics. Of course, academic has also created some digital dashboards using this artificial intelligence, and of course has contributed to the hotspot identification, early warning systems, and etc. Of course, this is in brief. There is a lot of work ongoing under the academic, and of course, I have to show you some of the work, for example, which is written by Dr. Nicola Bragatsky, who was also a senior scientist under academic. For example, in this case, they try to mention some of the, of course, they try to summarize some of the timescale applications of machine learning and artificial intelligence by classifying into short-term, medium-term, and long-term applications of artificial intelligence. For example, artificial intelligence can be used for rapid identification of an ongoing outbreak for a short term. For example, artificial intelligence can facilitate real-time epidemiological data collection, risk assessment, decision-making processes, and other implementation of public health interventions. But as a medium term, artificial intelligence can also be used towards identification of potential therapeutic options, including already existing drugs or discovering new molecules that can be used for treatment. As a long term, artificial intelligence can also be applied in enhancing cities and favoring the development of healthy, smart, and cities, such as, for example, as an example is designing new standardized protocols for sharing data and information during emergencies. This is one of the work under academic. And another work that I want to show is that which was a work by one of the organizers, Dr. Blessing Ogbekwiri, which is also on vaccine hesitancy hotspots in Africa, where they used geo-target Twitter posts in order to identify the vaccine hesitancy hotspots in Africa, particularly South Africa, Nigeria, and other countries. Of course, in this case, another work was by the Dr. Zahra. I am also co-author of this work, which is on analyzing the impact of COVID-19 on the economy of different countries in Africa, where they used Twitter data in order to approximate the macroeconomic statistical analysis in order to make the prediction of, in order to analyze and make predictions on the impact of COVID-19 on the unemployment rate and etc. And they use, in this case, they used 4 types of machine learning algorithms, including the random forest regression, support regression, and again, gradient boosting. Of course, they have also applied the auto-regressing integrated moving average with other inputs, what they call it RMAX. Of course, this is a few of the works which has been going under academic by many researchers under academic, scientists and researchers under academic. This is just to simply show you that how artificial intelligence has been used in the past 2 years during the pandemic, COVID-19 pandemic, by researchers and scientists from York University and their collaborators under academic. Of course, researchers from South Africa, including Professor Bruce. Okay, so beyond that, of course, another reference is here, which is about machine learning and privacy, which try to summarize the different uses of supervised and unsupervised machine learning types towards emerging or re-emerging pandemics. For example, in the first case, they used the K-means clustering, which is unsupervised machine learning approach, in order to detect hotspots for emerging zoonotic diseases. And the other work, which is, of course, the numbers here are the number of citations on the paper, which I have put here as a source. And another, for example, another application of a machine learning algorithm is called, for example, the content analysis, which is unsupervised machine learning, where those researchers have applied this technique in order to make public health surveillance. There are other applications, for example, I can mention, for example, the neural network, which is type of supervised machine learning, which they have used to identify micro-clarification clusters in digital monograms. Of course, they also use that one to predict mortality rate in head trauma patients, and again, to predict influenza vaccine outcomes. Just this is a sample to show you that how machine learning and or in general artificial intelligence is useful in public health and global health towards prediction, and again, of course, early warning detection and hotspot detection and risk management. There are different approaches. For example, we have decision tree support vector machines, where they have been used again. For example, the support vector machine has been used in diagnosis of diabetes and again detection of depression through using Twitter data. And again, another approach in this case is we have supervised learning, which is a decision tree, which they have applied it in order to identify infants at high risk for serious bacterial infections. Of course, they have applied also for cost effectiveness of different influenza treatments, and again, physical activity from other sensors. Okay, so there is another work here, which is on the new directions in artificial intelligence for public health surveillance. I don't know how much time I have. Let me know.
Your time is actually up. We need, yes, it's actually up. We just have 2 minutes so that we can be able to attend like few questions before we end.
Excellent. So I can jump this one. What they did in this case is also they used free text from emergency department in order to detect and localize the newly emerging outbreaks of a disease. So this is, for example, what they did. I am going to jump for this one. Probably there are a lot of other works that I tried to summarize in tabular form here. Of course, this one is not only machine learning, also this shows application of natural language processing and natural language understanding, and of course, natural language generations and cognitive research, which are also part of artificial intelligence, which they have been applied in public health units in order to do different aspects in towards public health preparedness and the response. I would, of course, want to mention clearly this one. I saw one of the questions was ethical consideration on the use of artificial intelligence, which is very important, which says that when we use artificial intelligence in public health, it must be guided by ethical considerations, where the ethical considerations has to be aimed on towards ethical risk in public health and has to be related with policy interventions. That is to mean that there must be patient safety and quality of care. And second, in this case, what do you mean that is that when we do screening, diagnosis, classification, prediction, treatment, those all must be supported by evidence, and again, they have to follow ethical considerations. In that case, what other considerations that has to be implemented for artificial intelligence public health is that the ethical principles of beneficence, which we mean is that the application of the artificial intelligence must be beneficial towards the health of the community and health of population. Of course, it must be also anatomy. We have to consider justice, and again, of course, along with the human rights such as dignity, and we have to have respect for life, freedom, health, and of course, self-determination. And the other problem is related with equity, justice, and privacy. Those are some of the terminology related with consideration of ethical artificial intelligence towards public and public health preparedness and response. Of course, these are the concluding remark is one or less I have mentioned that artificial intelligence has been showing rapid increase towards use in pandemic preparedness and response. And of course, we have to consider the ethical use of artificial intelligence. Thank you very much. And thank you very much. And I want to acknowledge the organizers and, of course, the academic CIPAL, which is also directed by Professor Ali Asgari, who is one of the organizers. And thank you very much. Thank you, everyone, for joining us today. If there are questions, I will try to answer some of the questions. Of course, there are a lot of questions which are related with artificial intelligence, machine learning, which cannot be answered in specific statements or few time, but I will try to mention. So how do I start with the questions?
All right. Thank you very much, Professor Asefa, for your presentation, kind presentation. We are running behind schedule. We are supposed to leave here at 1:30, but we'll try to take the questions and see how far we go. We thank you very much. But Professor Asefa actually talked about AI for pandemic preparedness and response. He also gave us an overview of AI for pandemic preparedness, starting from what AI is to machine learning and application of AI with focus to digital health and public health. So we also talked about, when we face pandemic, in the next pandemic, what are we supposed to do and how we are supposed to prepare and prevent the pandemic and what measures we should take, planning effect in terms of finding a way to manage our population, and a large effect of when we have a lot of people and how do we manage them. He talked about some key elements of the pandemic preparedness, which he mentioned to be strategic planning. Talked about strategic planning, operational planning, executive exercise reviews, implementation, and evaluation. He also talked about some key qualities, like he said, resilience and sustainable systems for health, public health, which he says prepare, prevent, and dictate and respond. He gave an overview of AI with respect to health and pandemic preparedness. He also talked about how we can use AI to, perform treatment, create vaccines, surveillance, perform forecasting, and have health equity and transmission. He mentioned some good things about the machine learning and different algorithms we could actually use to perform machine learning classification and predictions with health data. He also talked about how AI is being used in pandemic preparedness and early warning detections, supply chain management, and predictions. He talked about diagnosis and treatment and some ethical considerations we need to know about that. So that is a very good one for us. So I'm going to take the questions in a nutshell, and I will be fast about it. I will first take the questions from people that sent questions. So Professor Asif, I'm going to send the questions, or I'm going to send like 3 of them, then you can answer them as we go. Okay. So number 1 here says, what is the basic difference between data mining and data science? The basic difference between data mining and data science, that is number 1. And the second one is, how would we address potential bias in machine learning to promote equity? So I'll take them two at a time. So this is actually anonymous attendee. He says, what is the basic difference between data mining and data science? And Hong Chin says, how would we address potential bias in machine learning to promote equity? Over to you, Professor Stefan.
Okay, so it would have been better if you can ask me one by one. I almost forgot some of them. Or can I see the question?
The first one is, what is the basic difference between data mining and data science?
Oh, okay, great. I know so that data science is very broad field, which is a process of, for example, I would rather say that it's a process of gathering data, analyzing them, making prediction, and using them for the targeted question or the targeted problem. But data mining, I would rather say data mining is a subfield of data science, which is mainly focused on the utilization of the data for a specific problem or to answer a specific question. So data science is just the broad field which involves data mining, data visualization, data analysis, machine learning approaches and algorithms. But data mining is simply the utilization of data to answer a specific question. Or rather
All right. Yeah, thank you very much. And the second one is how would we address potential bias in machine learning to promote equity?
Okay.
So this is the issue of bias, actually.
Of course, this is, of course, the potential bias in machine learning and other techniques is a big problem, which cannot be solved in a very short time or a very short approach. Rather, what we have to try is we have to try to push in order to reduce or limit some of these potential biases and so on. One of the approaches where we can try to address potential bias in machine learning towards promoting equity is, in my opinion, is that we have to make sure that, first of all, when we try to train the machine learning and use the data as an input, we have to try to make sure that we try to use a data which considers both equity. If we can get a data which considers, for example, gender index or macroeconomic and social economic index, that would be important. But if the data does not include those types of factors or those types of dependent variables, the next question that we have to approach is that what type of algorithm are we using for the machine learning? And we have to make sure that when we conclude our results to that specific research, we have to clearly mention that the data we have used didn't consider those gender index or other socioeconomic indexes, and the conclusions or recommendations that have been concluded in that research does not consider this biasness. So that's one of the things that I can mention. But of course, this is a big problem that cannot be solved by one or two ways of addressing this one. The only thing that I can say is that we have to push ourselves in order to make sure that the biasness in the machine learning approaches to promote equity has to be addressed one way or the other, either by using data which considers those indexes, or also by considering the machine learning techniques when we do the result.
Thank you. Another one is in data analysis. How do we, that is from James Evans, how do we handle missing data? How can we handle data that is exposed and affected by virus? So how do we handle missing data?
Okay, so I will start by how do we handle data which is exposed or infected is that, of course, one of the problems is that when we do mathematical modeling infectious disease, we have to make a distinction between exposed and infectious. This is something very important. And in the case of infected, that can be counted, and we have a count data. But in the case of exposed, there we don't have a direct measurement to have a variable as exposed data in our data set. So the only way that we can do is, one approach that we can do in order to handle exposed in our data is we have to use some machine learning techniques in order to make estimation and parameter estimation and curve fitting in order to estimate the data for the exposed compartment. Of course, the infected compartment can be directly measured from data, such as, for example, number of cases or prevalence or incidence. But the exposed is something that cannot be directly measured in most cases, and we have to use algorithms or mathematical fitting in order to make estimation for the exposed one. But the next one is, how do we handle missing data? This is also, there are a lot of packages in machine learning and, of course, in data science that can handle the missing data. And I would not just try to give you a specific answer, but there are different approaches. The only thing is that before you use the data, you have to have pre-cleaning, what we call in the pre-processing in the case of data. One of the pre-processing is that trying to handle and make careful observation about the missing data. So before you apply or before you use the data in order to train your machine learning approaches, first of all, you have to make pre-processing and pre-cleaning in order to avoid one of the problems is with missing data. And in that case, you can create a new data set from the existing data set by avoiding those missing data in order to train the model. And of course, this is something also the disadvantage or the problem with handling data in order to train machine learning approach. But there are different approaches and techniques in machine learning. There are different packages and of course, different algorithms that can help us in Python, MATLAB, and others.
All right. Thank you very much. Just before we end it for today, I would like us to take some questions from the people that raised their hands. Alice, Oluwafunke, okay, I don't know if you are there. If you are there, please, could you put on your microphone and ask your question? The second person left, okay. Alice, are you there? If you're there, could you ask your question?
Yeah, I'm here. Thank you, the presenter. Actually, what I wanted to ask is with the recording be made available, and the answer had been sent to the chat room. So thank you, sir.
Okay, thank you very much. The second question, the second person is no longer here. All right, so I think that is it for us today. We have a whole lot of questions here. Well, these questions can be channeled to Professor Asefa to his email. I won't be able to take all the questions today. And I want to, by this time, take Professor Asefa, please send your email address to the chat so that people can contact you directly and send these questions to you. I see a lot of questions here, and we won't be able to take all of them at this time. So our participants, I want to say thank you very much. You can stop sharing, sir.
Okay, you want me to stop sharing?
Yes.
Excellent.
Yes.
Oh,
thank you very much.
I could have seen the chat here. Oh, when I was sharing, I couldn't see the chat.
Okay. All right. Thank you very much. On behalf of the AI for PEP organizers and our director, Professor Jude, our directors, Professor Jude Kong and Professor Ali Asgari, I want to say a big thank you to all of you for attending, for being part of our second AI for PEP lecture series. We are going to be having another lecture series in 2 weeks, which is on the 20th of March. And the communication will be sent thanks to Francesco, who has also been helping us with the communication, and the website is also up. You can also go register if you haven't and help us to share and communicate to people. So we want to end it here today. For further communication, the questions that you have, you can actually send to Professor Asefa, send your message up directly to him, or rather your questions directly to him. And for any other information you need about the lecture series, please do not hesitate to contact any of us, myself, Francesco, or any of the team. We want to say thank you very much. And for those of you in Global South Africa, the Caribbean, South America, Asia, this lecture is actually targeted for you. If you have any locally driven data, health data, you can be working with it. And if you want to collaborate with us, we are open and willing to welcome you and see what we can collaborate with. From my side, that is it. And Francesco, do we have anything?
No, I think that's everything. I'm just going to stop the recording now.
All right.